I'm Alexander Finlayson. I started Medicine in Africa in collaboration with the first cohort of doctors graduating in Somaliland, and the purpose of it was to, in a relatively early stage for the internet in Somaliland in many ways, to create a platform for rapid exchange of technical resource and capacity building skills between the South London healthcare ecosystem and the Somaliland healthcare system, recognizing that one was better resourced than the other, and creating a channel that would enable the exchange of information and people so that they could help to do the things that would be necessary to gradually build the health system in Somaliland through the health workers there. Yeah, well, we'd had various quite significant grants through programs that DFID had initially funded, but we were tremendously excited to be the first recipient of the Department for International Development Sphere Programme Strategic Partnerships in Higher Education, Innovation and Reform. Lengthy acronym in some ways, but the premise of it was that lots of focus in the aid sector had been on the education of primary school students, and particularly young females, and this was the Department of International Development recognizing the need both for higher education institutions that resulted in people being educated across the whole ecosystem within a country, and this was one of their flagship attempts to move into that world. And second, the innovation word was important, that increasingly technology had a lot of purpose in supporting these types of programs. So when you brought those two together, building capacity in higher education systems and using technology to do that in a way which was adaptive, i.e. it wasn't too fixed to some of the old models of delivering aid in terms of very clearly pre-specified goals with no ability to flex according to the environment. We were a good partner for that, given the context and the longevity of our relationship in Somaliland and our use of technology in that, at that time, quite challenging environment. And so it's a huge government program. We were delighted to be the first recipients. The whole program's been designed since then with many more recipients, but it was a kind of huge excitement for us to be part of that early stage in development of DFID's thinking about higher education systems. We were always designing it as a tool and program, so a thing that would facilitate those activities happening at bigger scale in more frequency with more evaluability. And things that I'm particularly proud of are the introduction of mental ill health into the curriculum. I'm particularly excited about the fact that all the medical doctors that have been through the medical schools now in Somaliland, which has become a much, much bigger number, have gone through the Medicine Africa programs across more or less all medical disciplines. I'm excited about the strategic projects that the healthcare workers have taken part in collaboration with the health workers here in the UK. And I'm really excited by the leadership and development work through training the trainers that has supported the building of capacity in the workforce, in the health education workforce in Somaliland to create more sustainability. And then in and around the fringes, as a consequence of this relationship between two health systems, I think it's catalyzed because there was this kind of perpetual connection between two places that otherwise are very far away and back then were very disconnected. It's catalyzed lots of adjacent programs. People, hundreds of people have been involved in contributing into the programs in Somaliland, and hundreds of people at the other end have been involved in having some of those programs and contributing back to programs. We're creating systems and processes for universal healthcare, but also that health workers are exchanging technical capacity so that the workers in different countries are all brought up to the same level, and hopefully eventually that results in a very mutual exchange. Well, I remember listening to something about Twitter once, and it was described that it was a kind of, they wanted a single unified brain where the information would be transmitted around the world quickly and everybody would have access to it. I think driving towards a position where all healthcare workers are brought up to a similar capability and then exchange information relatively rapidly across the global health system in terms of the health workforce feels like it's going to require technology to do that. So I guess what would be brilliant is if at one point in the future it was very simple for any healthcare worker anywhere to receive either the education or live clinical support necessary from the people who have the capacity and capability to support their progression and development, and for that not to be something which is siloed globally.